Many thanks for staying with us. Good morning. Kenya continues, and now we want to have a discussion still surrounding coronavirus pandemic. We want to understand how it has been for the medical experts in dealing with this dealing with COVID-19 patients, even as these cases continue rising. As of now, we stand at 490 confirmed cases here in the country. So how exactly have the medical experts been handling this coronavirus pandemic, and how exactly have they been dealing with patients? To help us understand more about that is Dr. Shamsa Ahmed, who is a consultant physician at Shah Hospital. She'll be helping us understand more about that. Thank you very much, Dr. for making time to join us on the show this morning.
All right. Morning, Doreen. Thank you.
Good morning to you.
Doreen. Thank you for having me.
All right, good morning to you too, Dr. And now let's just begin with the whole aspect of how it has been for you being on the front line as the head of COVID-19 unit at Shah Hospital. How has it been so far? Walk us through that journey since when the first case was announced in the country in March, and even before that and up till now. How has that journey been like?
I mean, the first thing is when we started getting these images out of the UK, China, US, I mean, it was really disheartening. It was heartbreaking to see what was going on. And we were trying to see how is our health system going to be able to cope with something as big as that, considering all along we've thought Europe and the US were like hallmarks of healthcare. So the first thing comes in with like re-strategizing, looking at our facility, wondering, do we have everything in place? And I mean, that takes a lot of effort, even from the administration and looking at your doctors and nurses, apart from just the senior doctors, the junior doctors and the nurses, and saying, do we have the training? Do we have the equipment? And seeing how are we going to go ahead and look after these patients. I mean, one of the most heartbreaking decisions we had to make was looking at how do we de-escalate other services so that we can protect our patients who are coming to the hospital. Certain things are not going to stop happening. Women are still going to be having children. Dialysis still needs to go on. Cancer care still needs to go on. So you need to know how are you going to keep your hospital safe for your general patients, and then work into how are you going to manage the COVID-19 patients. So one of the first things we did was we actually came up with a physical structure for the COVID-19 patients. And we started off with an isolation unit of about 11 beds, but considering the numbers of patients that we were getting in, some who were quite sick, some who were stable, some who were asymptomatic, we had to upscale and make an isolation unit of about 21 beds for these patients. One of the things we've seen with our patients is so far they might not have been as sick as the patients that we've seen in China or we've seen in the US. But sometimes you ask yourself, which is worse? Having somebody who is tested COVID-19 yet has absolutely no symptoms and still has to confine themselves in a hospital for at least 2 weeks. And in that duration, asking themselves, are they going to fall sick? Are they going to end up in an ICU setup? So there were a lot of things that we kind of had to put into place for them.
Okay.
If you look at our patients, I mean, they do struggle. When you arrive at a hospital, you're coming in an ambulance, you're surrounded by people in these white suits, you don't get to see their face. You get into a hospital, you don't get to see the doctors' faces, you don't get to see the nurses' faces. So some of these things have made, I think, all medics also come up with a little bit of ingenuity in how you're going to manage your patients. For our patients who have been stable enough and have the means of a smartphone, one of the things we try and do with them is maybe have a video call later so they can put a face to the name who's making decisions about, what's happening to them while they're in the hospital.
All right. You also mentioned something about trainings. Just before we continue the whole aspect of dealing with this patients, so far in terms of training of these health workers, how can you say that has been here in our country?
I mean, the government themselves have done quite a few initiatives. So the Ministry of Health and having different trainings at different centers. Specifically for our institute, we had to look at in-house. We have a very strong physician team and look how at developing training specific for our institution. See, there are general guidelines on how you'll manage patients, but you have to look at what's the infrastructure that you have in your building. How do you create safe spaces for these patients? How do you create safe spaces for the medics to manage them? I mean, right now, the key word that everybody has is PPE, but something like PPE, you need to know how to put it on, how to take it off, how to dispose it, how to feel comfortable in it. I mean, putting on that gear, there's been a lot on TV. You're seeing how much effort it takes to put on all that. And then you still need to be able to assess your patient in a safe way, make sure that you're not making any mistakes with them, do all the necessary things that you'd have to do for the
Okay.
patient.
Okay. All right. So now, coming back to dealing with these patients, the numbers are rising, and so far for the past 2 days, we've been recording double-digit numbers. So ultimately, which means that these numbers are rising day by day. So coming to dealing with these patients, what would you say is the major difference in terms of dealing with COVID-19 patients and other sets of patients?
I mean, honestly, I think the biggest thing is the amount of fear that's
Yeah.
come with this.
Okay.
I mean, we do have to accept that COVID-19 is something new. It has been deadly and disastrous in quite a few countries. You do have to manage these patients with quite a bit of protective equipment. So I think the first thing in terms of healthcare workers is getting rid of the fear. And I usually say when you panic is when you make a mistake. So for your healthcare workers, when you're coming into managing a COVID unit, ideally we're a team. There's nothing like a hierarchy. We're all working together. We're working for the purpose for the patient. And then when you're looking at that patient, you have to understand that this is a person and not just a label of this is a COVID-19 or this is a corona patient. I mean, this is somebody's mother, this is somebody's husband, this is somebody's father. And they have quite a bit of fear when they're coming into the hospital as well.
Okay.
And like I keep saying, I think the toughest one is somebody who is completely asymptomatic, not feeling sick, but has been told you have a diagnosis of a deadly disease. And now you're going to have to be in this situation where you can't come into contact with people. I mean, if you look at Kenyans, one of our favorite things is coming to visit people in the hospital. If you look at most parking lots during visiting hours, they are full. We love coming to see our relatives. I mean, if I'm admitted, you should see the amount of my relatives who end up in a hospital.
Okay.
But now, yeah, when I admit you, unfortunately, we can't have visitors. We need to, and your family for that duration tends to be everybody who's in the hospital around you.
All right. And also you've mentioned something very important, the asymptomatic persons, and we'll be coming to that a bit later. But now, in terms of how you've been managing this disease at MP Shah Hospital as the head unit COVID-19, what kind of strategies have you employed to better manage COVID-19 cases there?
I mean, first of all, we had to develop our own in-house hospital protocol for every small thing. Usually when you come into a hospital, you just walk into a casualty or you walk into the doctor's office, you go through a nursing station, and you'll see the doctor. But here we had to work out how do we get the patient in the hospital in a way that's also humane for them, not feeling like, there's some kind of exotic animal or something dangerous that's being brought into the hospital,
Yeah.
making the environment, the room safe for them. And the first thing when you get a patient, you really need to assess them and see where do they fall. Are they in an asymptomatic category? Are they mildly ill, maybe just having a little bit of a flu or a sore throat? Is this a patient who's got a mild pneumonia
Yeah.
or a severe pneumonia? We have had a unit for suspected patients, which is also run by a separate physician. So one of the things is separating the doctors and nurses who deal with COVID positive and then having a non-COVID unit. And the suspected patients are usually managed by a completely different team, but at that point, you still have to treat them like they are likely to have COVID. So the same kind of protective mechanisms you'd be using and stuff in terms of dressing and all is done for those patients. And then depending on your testing, if they become positive, then maybe they move on to my unit. If they're negative, now they can move on to a general unit. And then treatment, again, is dependent on where you place your patients.
All
There's been
right.
a lot of discussion of experimental treatments, but we have those are international guidelines, and guidelines just guide you. But we have Ministry of Health guidelines, and then you have to look at your individual patients and what you're doing in your hospital.
Oh, okay. Now, what has been the trend like of COVID-19 patients, especially at MP Shah Hospital? Has there been any success stories, probably cases of recovery there?
So I'm really happy for the patients that we've had here. I mean, we've had over 20 patients, and we've had at least 17 recoveries.
Okay.
One of the best days that we've had in our units, I mean, is when you get to tell that patient, which is true for all medical issues, but for COVID patient to tell them that you're negative and you can actually go home. I mean, we've had patients like dancing in the middle of their rooms because, they've been isolated for so long, they've been so concerned. And one of the things that we specifically put in place for our patients is psychosocial support because you do need a debrief while you are here. You need a debrief before you're going home. I mean, reintegrating back into your home and into your workplace is also quite a challenge for these patients. So even when they go home, we still have quite a bit of follow-up with these patients. and they might be at home, but they'll also be texting us and calling us and letting us know how they're doing.
Okay, now
So
you
we've had
meant.
a number of patients going home.
Okay, so you've said that at least there has been 17 recoveries, which is a good thing because what you're hoping and praying for is that people can continue recovering even more. But now coming to you as a doctor, what does this do for you? What kind of motivation does it give you when you know that probably you attended to this patient and now finally they've gotten healed or now they've recovered from the virus?
I mean, it's the biggest thing that you can get as a doctor when your patient gets well from anything.
Okay.
So, especially something like this with lots of, there's so much fear, so much trepidation with this disease. So, I mean, it's a great motivation. And like I said, when this first came in, we were really looking at whether we turn out to be like all these countries, because the videos we're watching, it looked like something out of a movie. And having said that, it's not that we're out of it yet. There's been a lot of, government measures and things that we've done as individuals, which is what has mitigated what's going on here. But I mean, we still have some way to go. Like you've said, the more testing we're having, the more positive numbers
Yeah.
are coming up. Yeah, so we're doing better, but it doesn't mean that we're exactly out of the woods. But yeah, the best feeling, I mean, in the unit is when you get a patient who's been there, hasn't deteriorated, done well, and then manages to go home. I mean, it's truly amazing.
All right, so Dr. Shamsa Ahmed talking to us about how they have been handling COVID-19 cases at MP Shah Hospital. That is a discussion we're having this morning. And she says that 17 recoveries so far at that specific hospital. Now, coming to another issue, this is the aspect of stigmatization. It has been going on at least so far, especially for patients that are recovering from this pandemic. At the hospital, do you have any unit that caters for probably guidance and counseling to walk patients through in this difficult time, to probably guide them, to counsel them, and even for those that will recover, for how they can deal with stigmatization as they get out of hospital?
Yeah, so like what we said, when we came up with our protocols, I mean, the psychosocial support was really important for the patients. Yeah, first of all, I mean, for any diagnosis of any disease, you tend to need that kind of support because it's difficult even for the individual to differentiate themselves as a human from that title that we're giving everyone of corona and COVID. So we do have that psychosocial support that happens continually for the patient during the duration that they're here, when they go home. I mean, you see, the psychosocial support even extends to the staff because the moment you designate healthcare workers to work in a unit, it's very easy for everyone around them to also be like, oh, this is the COVID doctor or this is the COVID nurse. So you do need to provide a lot of psychosocial support. And even sometimes it doesn't have to be a designated individual, but the same doctors and nurses and even the cleaning staff and the lab personnel who get in touch with these people are the same guys providing quite a bit of support for them during their stay and then helping them integrate. I think unfortunately stigma is just something that happens in all our communities for a lot of reasons. But the only way to combat stigma is education. And I think as we see that loads of patients are getting better and are able to go back home, go back to their families, get back to work, I think those are the kind of positive messages we need to be sharing, apart from all the doom and gloom and all the other kind of, stringent measures that are coming up from everywhere else.
Okay, also another aspect that really comes out, especially for COVID-19 patients, is for the ones that have recovered, is the aspect of reinfection. What chances are there, especially after COVID-19 patients recovers? What are the chances of reinfection of this same patient?
I mean, like we've said, this is a new disease. I mean, it's being investigated all over the world. So most of the time when you get an infection, your own immunity needs to fight it off. And then depending on the kind of infection, sometimes you develop an immunity that can give you maybe a month or so, or give you lifelong, or you don't get any immunity from the disease. And that's what's being investigated like world over. But you see, once you are treated and the infection is gone, you're essentially like a new individual. If you don't follow the measures that we're all talking about, social distancing, you know, hygiene, wearing your mask, those kind of things, then the chances of reinfection are always there. I mean, it essentially becomes like just the chances of any of us getting infected if we don't follow this. And I think we all kind of have to accept that we're moving into a new normal. Even if we haven't had such a difficult time in Kenya, we are masks are going to be with us for a while. Social distancing is going to be with us for a while. Hand hygiene should have always been with us. I mean, they were just putting it in there a little more now. But we're going to go into a new normal, and COVID isn't going to go anywhere for a while. We're going to see if we get a second surge. I mean, if we're going to get a surge, we're going to see if we're going to get a second wave. So the chances of reinfection, unfortunately, are always there, even if you've had an infection and been treated and recovered since then.
Okay. And at Shah, have you had such cases where a patient that was infected recovered and then they came back because they were reinfected? Probably if yes, how have you dealt with that?
No, fortunately, none of our patients have come back with
Okay.
any reinfections. All our patients have gone home, have been good, even on follow-up follow-up investigations and looking at them. We haven't had any cases of reinfection. But I find that unfortunately, once you've been infected and had to go through all of this, I think when you go home, they tend to be a little more cautious as opposed to, the rest of the population.
All right. Now, what are some of the factors? Because yes, in as much as we talk about reinfection, just like what most people have alluded to is that a good immunity is one of the things that can also help you prevent yourself from contracting this disease. But what are some of the factors that can make someone to be reinfected? Is it poor immunity? Is it getting close to someone probably who has the disease or not? Just what are some of the factors?
I mean, one of the things is you need to look at the comorbidities somebody might have. We keep talking about a good immunity or bad immunity, but a lot of the patients that we have had are young individuals,
Yeah.
healthy, have had no issues. So maybe the question is the contact they came into. Was that a very strong strain of the virus? Was it a heavy dose of the virus that they got? But the populations that we're still concerned about is if you have compromised immunity, and that comes with maybe patients who are on dialysis, patients who are diabetic, patients who are having any kind of cancer treatment. So we go back to the basics. Unfortunately, when it comes to this, we go back to social distancing, hand hygiene. Mass testing is still something that we advocate for. I know with mass testing comes all the fears of, being sent to a quarantine center and things like that. But the issue we have is when you have someone in the population who is extremely looking, but is what you call a super spreader, meaning they have the virus, they have no symptoms, but as they come into contact with people, they're the ones who are spreading it. So again, I think it's going to be a while before we get back into this normal kind of society where we're always mingling and mixing and that kind of thing.
All right. So you've just said that mass testing is something that you continue advocating for, which is a good thing. And we've also seen at least the government roll out mass testing in some parts of the country, which again is a good thing. But then now coming to families, especially for families that might have someone or one of the family members is infected and probably there's someone in an isolation center or somewhere in hospital, what kind of message do you have for such kind of families? Because we know anxiety may really be so high.
I mean, anytime your family member is sick with anything already, there's an element of anxiety. But you, at least at that point, you can go to the hospital, you can see them. So, I mean, the thing we need to understand is a lot of these measures are very difficult. I mean, even if you end up in an isolation center that you're, maybe you're happy with and you can afford or things like that, it is still difficult for the individual to be isolated. It is difficult for the family, and that goes back to fear. So one of the things that we do is we try as the medical team to even have updates with the family while they're here, because you might not be able to come here and have a conversation with the doctor, but at least maybe if you talk to the person who's looking after your husband or your father, your daughter, and let you know what's happening with them, how they're doing, when they're going to go home, and what to expect when they go home, and how everybody reintegrate. I think people have a lot of fear. People come into hospital and say, when you discharge me, can I take my luggage back home? Because they're worried that that's going to infect their family. Most people are not worried about themselves. Everyone's worried about, if I go home, am I going to put my children, am I going to put my spouse at risk?
Yeah.
So those are things that you do have to talk to your patients about. You have to talk to the family. I mean, I think half the time getting better is the conversation you're having with your doctor, knowing that you can trust the person who's looking after your family member. So it's not as simple as just giving medication
Okay. Okay.
tablets. This has to be like a holistic approach to the patient.
So now, still sticking with families. Now, for families that have maybe probably one of the family members has recovered from this disease. Again, there's also that fear of anxiety. One may think that I don't want to stay close to them because maybe they just that fear of they might infect me in as much as yes they've recovered. So how can such families cope? Those that may have recovery cases.
I mean, again, it's all going down to education and these messages that we're sharing that by any facility, whether it's government or private, is letting someone go home, then we have ascertained that this is a person who no longer has a COVID infection. So that means you're not at risk of picking up anything. Having said that, when you discharge someone, you still need to let them know that there's an avenue to come back and talk to you. If you go home and you get a little bit of a headache, and I mean, in life, you're going to get a headache, but at that point, when you've been a COVID patient, anything you feel, you don't know, does that mean I'm falling sick again? So they need to be able to come back and talk to you and let you know what's going on. But I think for the families, it's about letting that person back in, getting back into as much of a normal life as you can, because they're not a diagnosis. They're somebody who, unfortunately, in the line of work that they were doing, were exposed to something. They have healed, they are home, and we have more of those positive stories while we're still putting in all the measures to make sure that nobody else falls sick.
Okay, so there are some members of the public who still don't understand the importance of this mass testing, even in as much as the government has at least begun rolling out mass testing in some parts of the country, especially for those that are being regarded as high-risk area. So from a doctor's point of view, make us understand what exactly is the importance of this mass testing, at least for the public to understand and not shy away from testing.
The whole purpose of mass testing, again, is just to know who is positive and who isn't. And again, it doesn't mean that you're sick. It means you have virus. Like we said, you have huge amounts of people who have no symptoms, doing well. So our issue comes with a patient who is COVID positive, has no issues, probably looks healthier than me, but is maybe going back to their grandmother or their spouse who goes for dialysis or works in school with children. What happens is if you don't know your diagnosis, you are likely to be spreading it to somebody else. And maybe that person's immune system isn't going to be able to tolerate it as much as you. And fear comes with all the horror stories we've heard about quarantine centers. You see, unfortunately, I know it's a difficult and kind of a delicate balance to have to figure out how do you take patients who are positive and make sure that they don't infect other people. In an ideal society, if patients would quarantine at home, that would be the way to go. And that's usually what's happened in other countries, but you see their healthcare systems were overwhelmed. And we do have to kind of take guidance from, our Ministry of Health in terms of how they want to approach the pandemic. Because if you look at us and you look at neighboring East African countries, our numbers and even how our patients are doing is much better. And some of this comes from, very stringent measures they put in place, like closing down airspaces and things like that.
Okay.
So testing is still important. We all eventually will have to get tested. Even the healthcare workers who treat these patients ideally are a population who need to be tested. Because I can look really healthy, be using all my protective gear, but even for me as doctor, my concern is when I go home, even if I follow all these procedures, there's a risk of am I going to infect, my family when I go home. So there are those sacrifices, I think, that have to come from both sides.
Okay. So testing is still important. Maybe, Dr. What can the government do? Because as it is, Kenyans are still shying away from this testing. Some are even saying that come and test us for hunger first before you test us for coronavirus disease. So maybe what can stakeholders do at least to make Kenyans comfortable to feel that, yes, it's important for me to get tested when they say I need to get tested?
I mean, it's a valid concern. What's going to kill you first? Is hunger going to get you before COVID? So it is a valid concern. Again, I think it goes back into that balance. Quarantine should not be punishment. Isolation should not be punishment.
Okay.
You testing positive for something that you are not looking, it's not like anybody's looking to get an infection. So those kind of areas ideally should not be punishment. But this is new. I think everybody's kind of grappling with how do we deal with it? How does our healthcare system deal with it? So I think we need to make sure that people understand that testing is for their benefit, for their families' benefit, and not punish people when they turn out to be positive, which again is it's a really delicate balance. You see, even the facilities, our public hospitals. I mean, I have many friends working in those facilities. I am lucky to work in a facility that we've got good support from management. I know that I always have protective equipment and things like that. But when you look at the facilities that might not have as much, then you know that even like government Ministry of Health needs to make sure that all those facilities have the equipment so they can deal with the patients and give out the same kind of message that we're giving out on this side.
All right. So Dr. Shamsa Ahmed saying that testing is important, and especially for you as an individual, and also to help protect you and also protect the rest of your family members. But now I was looking at your bio, Daktari, and just you have been involved in active research in cardiovascular disease in this population. Now, using that background, especially of research, do you think that researchers and scientists can be able to get a vaccine or even probably a cure for this disease? What are the chances probably?
I mean, you see, everything is evidence-based, and the biggest thing we need is time. We need time and numbers. So what we need is collaboration between the private facilities, the government facilities, looking at our different demographics, our population, seeing what is the difference. Why is it that patients in the UK have been much sicker than our population? I mean, we had many theories. I mean, everybody's looking at what's on Facebook, and even looking at the scientists, we had many theories. At one point, we said, was it our climate? Was it the fact that we've had, the vaccinations for TB as children? Is it our malaria? But then as we go along, we're finding different things. Tanzania is our neighbor, which ideally is our demographic, but you see how it's affecting their population is turning out to be very different from what's happening here. If you look at the States and the UK, there are many trials going on for vaccines, for drugs. I think eventually we will get something, but it is going to take some time. So while we're waiting for, the fancy things and the medics to do their research and their science and come up with something, as individuals, we have to do our part. I mean, hand washing, again, it's easy to say hand washing in areas, where people have water. So we need to make sure that the people we're telling to wash their hands and social distancing can actually put those things into place.
Okay, so even in as much as you say that everything is evidence-based, and also just drawing from your doctor's background perspective, whereby you may probably be relying and believing so much in science and research, but let me just pick your mind on what you have to say in regards to these herbal medicines that people have been coming up with, saying that this, it can treat corona. We've also had cases of Madagascar where they came up with, with some herbal medicines, people coming up with different forms of treatment. What can you say about this herbal medicines that people are coming up with?
I think generally I'm cautious with the word herbal.
Okay.
Because one thing, anything that comes in a tablet form is no longer, this natural component. It's had to go through some chemical processing. When we give you a tablet of Panadol, we know everything that's in Panadol. Trials have been done on Panadol. We know how Panadol will affect people. We know what's the possible complications, side effect, dosage. We know all of that. We're not discounting that maybe one of the cures will come out of something natural or nature. But my concern with herbal medication is you don't know what's in it. You don't know what it's does it interact with any other medication you might be on? If you get a side effect from that herbal medication, do I have anything to balance it or treat it with? I mean, I've seen so many things that could possibly treat. I think if you talk to my mom, she'll tell you maybe aloe vera will be the cure for COVID, but we leave everything open, but I would still stick to evidence-based medicine. Maybe something will come out of nature, but I still feel this herbal thing, I would still be very cautious with something like that.
Okay, so you think that you're a bit skeptical about the term and the word herbal. But now, as you even bring the conversation to a close, the issue of isolation centers, I mean, cases are being recorded, just like when we mentioned when we were beginning. But when you look at the isolation centers here in the country, such as Kenyatta Hospital, Mbagathi, and the likes, do you think that we have enough isolation centers to continue catering for the high number of cases being confirmed in the country?
I think we'd have to put in a lot of effort. There was a lot of effort done in Nairobi, and I mean, Kenyatta University, Mbagathi, and Kenyatta Hospital have done a commendable job trying to manage all those patients. Private hospitals have also done the same, but I think if we're still going to continue with the concept that as long as you test positive, you need to be in an isolation center, then we're going to really have to ramp up efforts across the country. And again, make these humane centers, not punishment, not like a jail setup or things like that. And then you see what happens is when you turn maybe private hospitals, even public hospitals into isolation centers, then those units need to see how will we continue to cater for the general population. We still have our patients with non-communicable disease like diabetes and hypertension, so you need to see what to do. Like here, we had to develop a telemedicine forum so that we can still cater to the general population. That way they can book an appointment, be seen via something like this or telephone, and then, make sure they get their prescriptions and their medications wherever they are. So as we ramp up isolation centers, we still have to make sure that these hospitals can cater to everyone else who still needs to come into hospital.
Okay, now there was also another issue in which you had slightly mentioned earlier when we were beginning, and this is for the patients that they have COVID-19, they are COVID-19 patients, but they do not have the symptoms, because at least more of what we are knowing is that we are relying on the symptoms, probably like fever, coughing, to ascertain if someone is COVID-19 positive or negative. But then how is it possible for someone to be COVID-19 positive, but they're not exhibiting symptoms? What is the case scenario like?
I mean, you see, that's the thing. Having a positive test doesn't mean you'll necessarily be sick. Again, it goes back to which kind of COVID did you pick up, because there are various subtypes and strains. What is your immunity doing with it? A lot of times, just because you have the virus doesn't mean you have enough of what you call a viral load to make you sick, or your immunity chooses not to respond to it, which is why we've got a lot of research going into why do some people fall sick and some people don't. But again, it goes back to testing. Before we were relying on, have you traveled? Do you have a cough? Do you have a fever? But now, once we moved on to community-based transmission, we threw away a lot of those definitions. So the only way we'll know if we're positive is to go ahead and do the mass testing. And again, if I'm stable and I'm healthy, the reason I am testing and checking whether I'm positive is to make sure that I'm not putting any other vulnerable population at risk. So it's like many diseases, you can test positive for it, but not show any symptoms. And maybe you're in that duration where your body is just fighting off the infection. And if I didn't do anything and just followed you up in a couple of weeks and repeated the test, your body would have naturally gotten rid of the disease and you'd be negative.
Okay. Now, also another issue that I'd like you to clarify and make us understand, this is in regards to the plasma therapy as one of the stopgap measures. When you talk about plasma therapy, what exactly is that, and how can blood plasma of survivors help patients to heal?
So, I mean, when you get any kind of infection, your body's natural immunity tends to fight it off. So when that process is going on, what you create is something called an antibody. And the antibody tends to be very specific for whatever infection came in. So if you get a COVID-19 infection, ideally you create a COVID-19 antibody, meaning this is somebody who got infected, has recovered, you're going on maybe 2 weeks post-recovery, you have no symptoms, but when we take your blood, we're able to find these antibodies, the response to the infection. So I know most people have donated blood, and you know that big red bag that you give in, but what they do from that is we separate the components in the blood. So you get rid of what's the heavy components, which is pretty much the red part, and you're left with what is kind of a yellow liquid, which is the plasma. So the thought process behind that is if I could successfully fight off the infection, whatever is in my plasma, those antibodies should be strong enough to assist somebody else fight off an infection.
All right.
But again, this is a theory, because you see, not everyone who gets COVID-19 will necessarily produce those antibodies, and how long will those antibodies stay in the system? So this has been used in countries abroad, specifically for very sick patients, maybe patients who have been ventilated in ICU, and they have seen some improvement. Patients managed to get off ventilators, patients managed to use less oxygen. So it's a promising thing, but we'll have to see how it works.
All right. So thank you very much, Dr. Ari, for making time to explain to us how you've been managing COVID-19 patients at Shah Hospital.